pretty quickly through some of it. Just as a little background to kind of set the stage, I think this will set the stage for the rest of the day. What some of this, I'm trying to talk now about some of the significance of this issue. Why is this whole area of aging, technology, and healthcare important? Well, as you all know, we're seeing a very interesting demographic trend. We're all aware that there's a projected increase in the number of people at age 65 and older, not only in the United States, but pretty much in most developed countries throughout the world. And what's really significant about this is the yellow line on the graph, which is a growing increase in the number of people who are called the oldest old. Depending on how you define this, it's people over the age of 75 or 85, but we're going to see a lot more people who are living into their 80s, their 90s, even hundreds. And what we know about this group is, as one increases, so does the need for health care. Okay? Typically with aging, you see an increase in chronic conditions such as hypertension, heart disease, cancer, diabetes. These conditions all require some type of medical care, some type of support. And most older adults, especially as they get in the upper decades, many of them have more than one of these conditions. It's not uncommon, for example, for someone to have heart disease, hypertension, as well as diabetes. And we also know that cognitive and memory impairment tends to increase with the advancing years. Okay, there's a lot of work going on, as you know, in the field of Alzheimer's disease, given the projected increase in the number of people who have this disease in the upcoming decades. In fact, we're doing some of that work at the University of Miami.
Go on the other side.
So with the aging of the population, at the same time, we're also seeing a dramatic increase in healthcare expenditures. This is not only in the U.S., but in most other countries throughout the world. And we're seeing a trend from inpatient to outpatient care. I was recently served on a National Academy of Science committee where the whole discussion was centered around health care in the home. Okay, the recognition is that more and more health care will be provided outside of clinical settings, in settings like the home, and we'll be relying a great deal more on family members to provide care and support, especially to older adults who have some type of chronic illness or disability. Now, what's been happening simultaneously is we're starting to look at technology as a potential solution to some of the healthcare problems. So we're seeing a rapid diffusion of technology within the healthcare arena. Some examples of this include diagnosis, telemedicine, and I think the next speaker is going to talk about this in more detail. Diagnosis and treatment of patients at distant locations. This can be very beneficial, for example, for people who live in rural areas. Certainly monitoring of patients. Technology is used to monitor patients who have some type of chronic disease or illness. Simple things like an automatic message reminder. You can do online physician consults. And a big change that's happening, of course, within healthcare systems is the adoption of the electronic medical record or electronic health record. Many of these systems are starting to have patient portals. Okay, I'm actually working with the Institute of Family Health in New York, who has implemented the EPIC system, not just for physicians, but also for patients. So we're working with the Institute around usability. Are these patient portals actually usable for their patient populations? Okay. Here's just some simple examples. You can see someone doing an older adult who's doing a consult. That video phone is actually an example from some of the research study we just completed at the University of Miami. We actually installed those video phone systems in the homes of minority family caregivers of dementia patients. And we delivered an intervention to the caregivers while they were in their homes. That's Dina, who's one of our interventionists, and when the caregivers were in their home. That's what they saw. They had one-on-one counseling sessions with Dina about learning about caregiver issues such as how to be a caregiver, dealing with stress management, problems associated with dementia patients, etc. As I said, we have patient portals now. VMR is becoming quite used with more frequency. What can folks do with these? Well, they can make appointments, they can renew prescriptions, they can find out about their doctor, and they can also see their medical record. Okay? So they can track their own health and what happens with respect to lab test results, what happened with their last visit, what kind of medications are they on, etc. Other applications are online peer support groups. These are becoming more and more pronounced with social networking sites where people talk to other people who have similar conditions or need some type of support. There are also an abundance, and I'm going to talk more about this later, of health websites out there. They're growing daily that provide consumers with health information about health care, medication, treatment options, healthcare resources, services. You can buy drugs online. You can buy all kinds of things online. Here's our same system. This is the video phone again. Not only did we do individual counseling on that system, but we also ran video phone support groups. So this is what it looked like. We had 6 caregivers participating at once with a facilitator. And the person, whoever was speaking, their image was projected in the middle of the screen. Okay, and we had this system done in 3 languages, English, Spanish, and Creole, because one of our populations was Haitian. Those aren't caregivers, those are some of our faculty. Okay, I just wanted to give you a demonstration of what a support group looked like. And then, of course, as I mentioned, there are lots and lots of websites out there with health information. These are 2 of the more credible websites, WebMD, of course, and then NIH has a health website specifically for seniors, NIHseniorhealth.gov. Okay, so there are lots and lots of technology being used within the healthcare arena. What are some of the potential advantages of technology, especially for older populations? Certainly, it eliminates, logistically, it helps a lot. It eliminates the need for both patients and healthcare professionals to travel. If we just want to go back to that video phone study we just completed, we used to deliver that caregiver intervention in the home with face-to-face visits. Using the video phone enabled us to deliver the same intervention without the need for the interventionist to travel to the caregiver's home, or conversely, the caregiver having to travel to the university, which you know is difficult for many people, having to come to the university or go to a community support group. Certainly, technology prevents more flexible appointment scheduling. If you think about a patient portal with an EMR, folks have easier access to a wide array of information, services. Again, this is particularly beneficial for rural and underserved populations, increased access to specialists. And what's being talked about with all of these applications is, in fact, that patients will be empowered. Okay, access to this information, to these various applications will allow them, for example, to be better prepared for visits to their physicians. They'll be able to ask more well-informed questions. They'll have better information on treatment options, etc. So what are some of the potential disadvantages of technology that we need to concern ourselves with? Well, one is the proliferation of too much information or incorrect information. While there are lots and lots of websites out there, it doesn't mean that all the information on those websites is credible or correct. There's a potential disruption in patient-physician relationships. As you know, many times physician visits are quick. The doctor has 15 minutes to interact with their patient, And what some of our clinicians are talking to us about at our center is that